Hello everyone. Today we are going to discuss about the general pharmacology that will helpful in both in your GPAT examination and also for semester examination. For the beginners, it will be very difficult to study general pharmacology in standard books. So I made it easy for beginners. In this topic, we are going to discuss about topics such like drug. In the topic drug, we are going to learn about what are agonist, what are antagonist, and others like what are partial agonist and what are inverse agonist. Before going to these topics, I am going to discuss about two main subjects like what is affinity and what is efficacy of drug. Okay, if we understand these two topics, then we can easily memorize these four topics. Okay, now first of all, what is affinity? Okay, for suppose this is the cell, human cell, and this is the membrane. On the surface of the membrane, receptors are present. Okay, these are receptors. Whenever you take a drug molecule, for suppose this is drug molecule. Okay, affinity means nothing but the tendency of drug molecule towards the receptor. The tendency of drug molecule to bind to the receptor is nothing but affinity. Okay, next one, efficacy. What is efficacy? After the drug binding to the receptor, there must be some biological response within the cell, and this response is known as efficacy. Nothing but efficacy means biological response. Okay, now some people will get confused between these both terms, what is affinity and what is efficacy. It was easy way to memorize, like A comes first and E comes after A. Okay, in order to show biological response, the drug must bind to the receptor. Okay, so affinity is nothing, affinity comes first, efficacy comes next, like A comes first and after E comes next. Okay, it was easy. Now what is agonist, what is antagonist, what is partial agonist, and I will explain what is inverse agonist next. Okay, now what is agonist? Now we are going to compare agonist, antagonist and partial agonist with affinity and efficacy. Okay, I said that affinity means the tendency of drug molecule to bind to the receptor. Okay, for agonist, affinity will be present, and also for agonist, efficacy also present. What is efficacy? After binding to the receptor, there must be biological response within the cell. Okay. For antagonist will bind to the receptor, so it has affinity, but it does not show any biological response, so it has no efficacy. Okay, it does not show no biological response. Antagonist will bind to the receptor, but it does not produce any biological response, so it has no efficacy. But in the case of agonist, it binds to the receptor, it also produces biological response, so it has both affinity and efficacy both. In the case of partial agonist, the drug molecule will bind to the receptor, so it has affinity. But in the case of biological response, it shows submaximal response. It means low response when compared to that of agonist, full agonist. Okay, that is what partial agonist means. Partial agonist has both efficacy, but it shows only submaximal, means some response, low response when compared to that of agonist. Okay, so now we are clear about the topics of both affinity and efficacy. Affinity is nothing but the tendency of drug molecule to bind to the receptor. Efficacy is nothing but after binding of drug molecule to the receptor, the property of or the ability of to produce biological response within the cell is known as efficacy. Okay, affinity comes first, efficacy comes after affinity. Okay, here for antagonist it has affinity, the drug molecule will bind to the receptor, but it does not produce any biological response within the cell. Okay, it is very important to note. Okay, now coming to the partial agonist. After partial agonist, what is inverse agonist? What is inverse agonist? For suppose it was a cell and it was a receptor. The cell which has receptor on its surface, whenever the drug molecule will bind to the receptor, after that only it produces some biological response. Okay, but in some cases the receptor get activated in the absence of drug molecule. Okay, and it produces some biological response in the absence of drug molecule. Okay, in that case we will give inverse agonist. Whenever you give inverse agonist, for suppose it is inverse agonist, whenever we give inverse agonist, it binds to the receptor and it produces negative effect. It means opposite effect. Okay, opposite effect. Now example of this type of case is the activation of receptor in the absence of drug molecule. We will give inverse agonist, and such case, for example, hyperthyroidism. In this case, the receptors will get activated in the absence of drug molecule. Okay, in this case we will give inverse agonist. Also in some cases like GABA channel will get activated in the absence of drug molecule. In that case also we will give inverse agonist. But we are now studying basics of general pharmacology. When we go through this topic, it will be more difficult to understand. Okay. For just now we are discussing just some basics. Okay. Now we cleared the concepts of both affinity, efficacy, agonist, antagonist, partial agonist, and inverse agonist. Okay. Now we are going to learn about how drug molecule produce response. Okay. And one more, where does drug molecule acts in the body? Okay. Molecule acts in the body. Okay. Now first of all, what is drug? What is drug? Drug is a chemical substance that produces biological response. Okay, that produces biological response. It is not a vitamin and it is not a nutrient. Okay, it is a chemical substance. It is not a vitamin, it is not a nutrient. Okay. Now whenever you take a drug in your body, how does it produces biological response? Okay. In olden days, these drug molecules has a target molecules. Okay, they go and bind to their targets and they produces biological response. In olden days, these target molecules, they given a term known as magic bullets. Okay, magic bullets. The term it was given by Paul Ehrlich. He is father of chemotherapy. Later on studies they found there are mainly four classes of targets. There are mainly four classes of targets for drug molecules. They are first receptors. There are also several subtypes of receptors they are present. We are going to I am going to explain in detailed manner. First we are looking at what are those four classes. Okay, first one is receptors, second one is enzymes, and third one is transporters. Okay, fourth one is ion channels. Okay, now in receptors, first topic is receptors. What are receptors and where they are present? Receptors are nothing but these are protein molecules. Okay, these are protein molecules. They are present on the surface of the membrane of the cell. Okay, for example, consider this is as a structure of the cell, and these receptors they are present on the surface of the membrane. For example, consider this was a structure of the receptor. Okay, There are some subtypes of receptors, they are also present within the cell. Okay, later on we are going to study about these types of receptors also. They are present on the surface of the cell, but also they are present within the cell. Okay, now what types of receptors are mainly present in the body? Okay, for example, in a receptor there are four subtypes mainly. First subtype is ligand gated ion channels. Okay, ligand gated ion channels, these are also known as inotropic receptors. Here the name represents ion. Okay, inotropic receptors. And the second one is G protein coupled receptors. In short term we can call it as GPCR. It was a big family of receptors that majorly present within the body. It was mostly like 80 to 90% of receptors mainly present within the body are G protein coupled receptors. Okay, these are also known as metabotropic receptor. And 7 transmembrane helix receptors. What is meant by 7 transmembrane helix receptors is nothing but whenever I said that the receptors are mainly present on the surface of the membrane. Okay, whenever, for suppose it was the cell and it was a G protein coupled receptor that is present on the surface of the membrane, I said 7 transmembrane helix receptors. It means it passes through the membrane 7 times. It was, for example, it was first 1, 2, 3, 4, 5, 6 and 7. It passes through the membrane 7 times, so they are known as 7 transmembrane helix receptor. They are also known as serpentine receptors, because the serpentine receptors means they looks like some structure like a snake. So that's said to be serpentine receptors. Also they are also known as metabotropic receptors and 7 transmembrane helix receptors. They pass through the membrane 7 times, so they are known as 7 transmembrane helix receptors. Okay, and third one is enzyme linked receptors. Enzyme linked receptors. What is enzyme linked receptors? It means, for suppose the receptors that is present on the surface of the membrane, they are linked with an enzyme. Okay, these receptors are linked with the enzyme, so they are called as enzyme linked receptors. Okay, now fourth subtype, they are nuclear receptors. Nuclear receptors. Nuclear receptors means they are nothing but these types of receptors. They are present within the nucleus. Okay, they are present within the nucleus, hence they are known as a nuclear receptors. Okay, I said that there are two types of receptors that present are, one subtype is present on surface of the membrane, and there are also some types of receptors that is present within the cell. So all types of receptors like ligand gated ion channels and G protein coupled receptors and enzyme linked receptors, these three subtypes are present on the surface of the membrane, but here in nuclear receptors, the receptors are present within the cell. Okay, it is very important. These three subtypes receptors, they are present on the surface of the membrane. Now, after nuclear receptors, now coming to the ligand gated ion channels. Okay, ligand gated ion channels. We are going to learn about these types of ligand gated ion channels in a detailed manner. What are ligand gated ion channels? In the name, it represents nothing but what is ligand? Ligand is nothing but a drug molecule. Okay, drug molecule, or it may be a neurotransmitter. Ligand gated ion channel. Ion channel means ion means ion. There are four major ions that plays a greater role in our body, like sodium and calcium and potassium and chloride. Okay, ion channels. For suppose this was a cell, okay, and it was ion channel. Okay, in the ion channel, in the resting condition means in the resting state, the cell in the resting phase. Okay, the cell in the resting phase, the ion channel will be in closed condition. Okay, so will be in a closed condition. So the net charge that is present within the cell in the case of resting phase will be minus 50 milli electron volts. Okay, minus 50 milli electron volts. For suppose whenever you get, okay, whenever you get a disease or something, any condition, if you take a drug molecule, if you take a drug, the drug binds to the receptor that is placed adjacent some nearer to the ligand, this ion channel, or it may be present, the receptor side may be present on the ion channel. Okay, for suppose here or very close to the ion channel. Whenever you take a drug molecule, the drug molecule will go and binds to the receptor. After that, what will happen? Whenever the drug molecule binds to the receptor, the ion channel gets activated and it will open. Okay, here it was a closed in condition. After binding of a drug molecule, okay, for suppose it was a drug molecule and it was receptor. After binding of drug molecule to the receptor, it activates the ion channel and they will be open state. Okay, open state, and there will be result in influx of ions, or it may be result in efflux of ions. Influx means the entry of ions into the cell. It was known as influx. Influx means entry into cell. Okay, efflux means exit. E for E. Here also. Okay, exit from cell. Okay, whenever the ligand means the drug molecule binds to the receptor, the ion channel gets activated and it will be in an open state and results in influx or it may be efflux of ions. What happened in the case of influx of ions? Okay, in the case of influx, okay, influx, in the case of influx, for suppose we take sodium ions influx. Okay, I said that in the resting phase, the charge that is present within the cell will be minus 50 electron volts. After you take drug and it binds to the receptor, the ion channel will be open in state and these ions will gain entry into the cell. So there will be increase in the charge. Okay, there will be increase in the charge. If positive charge increased within the cell, there will be decrease in this negative charge. Okay, so here the charge will go from 50 milli electron volts to 0 milli electron volts, and this condition is known as depolarization. Okay, For just now, remember this term. We will learn in detail. Okay. In the case of positive charge gains entry into the cell, there will be increase in the charge. So this condition is known as depolarization. Okay. For suppose there will be gain of entry of negative ions like this chloride into the cell, there will be increase in negative charge within the cell. Okay. This minus 50 will goes to minus 50 milli electron volts. In the case of this negative ion will goes to minus 90 milli electron volts. Okay. This case is known as hyperpolarization. Okay. Hyperpolarization. And in these between two states there is a lot of difference. Okay. Both are ligand gated ion channels, but in depolarization case there will be increase in charge, but in hyperpolarization case there will be decrease in charge. What happens in the case of depolarization? There will be excitation. Okay. For suppose in case of like you saw a tiger or a lion, you get fear and you will run and you will get excited. Okay. What happens in the case of this excitation means increase in heart rate, increase in breathing rate, or increase in blood pressure, and increase in secretions. Okay. It will happen. These conditions will happen in the case of excitation. Okay. This ligand may be a drug molecule or may be a neurotransmitter. This process will happen. Depolarization will happen. Excitation, like when you run, increase in BP, increase in heart rate, like increase in breathing rate, increase in secretions will happen. But in case of hyperpolarization, benzodiazepines or barbiturates, in case of you are taking these drug molecules, these drug molecules will take in case of epilepsy and such conditions. Whenever you take these drugs, they go and binds to the ion channels and leads to the result in influx of a negative ion like chloride. Okay. Whenever this chloride will gain entry into the cell, there will be increase in negative charge within the cell. Whenever this negative charge increased within the cell, there will be opposite action occurs within the cell opposite to the excitation. What is opposite to the excitation? Relaxation. This will occur in case of this hyperpolarization. Relaxation will occur. In case of relaxation, what will occur? Increase in BP, increase in decrease in BP, decrease in heart rate, and like that will happen in case of this hyperpolarization. So there is one more important term. It was repolarization. Okay. Whenever, for suppose we know that in a resting state the charge is minus 50 milli electron volts. After depolarization the charge will get increased to 0 milli electron volts. Okay. After that if ion channels are opened, they are closed immediately. After it means they are inactivated immediately, so they must return to their resting state from 0 milli electron volts to minus 50 milli electron volts, and it means depolarization to normal resting phase. Returning of from state of depolarization to resting phase is known as repolarization. If the charge go further negative to minus 50 to minus 90 milli electron volts, it was known as hyperpolarization. So we are very clear what is depolarization, what is resting phase, what is hyperpolarization, and what is repolarization. Okay, don't get confused between this depolarization and hyperpolarization. Okay, depolarization means nothing but increase in positive charge, where hyperpolarization means increase in a negative charge within the cell. Here in depolarization you will get excitation, but in case of hyperpolarization you will get a relaxation. Okay, here repolarization means nothing but the process of comeback of these depolarization condition to resting phase condition of ion channels is repolarization. So we can tell it was also decreasing in charge within the cell for 0 milli electron volts to minus 50 milli electron volts. Mainly, I said that here the main four important ions that plays a major role in our human body are sodium, calcium, potassium, and chloride. Okay, chloride plays a greater important role in hyperpolarization. Okay, like it increases the negative charge within the cell, whereas here sodium and calcium that plays major greater important role in case of depolarization. Okay, depolarization means nothing but increase in positive charge. Increase in positive charge means influx of positive ions like sodium and potassium, whereas hyperpolarization means increase in negative charge. Increase in negative charge means it will be increase in influx of chloride ions. But here in case of repolarization means the process of comeback of this depolarization condition to resting phase. Okay, the main important ion that plays greater role in case of repolarization is potassium ions. Here in this condition, what will happen? Efflux of increase in efflux of potassium ions. Efflux of potassium ions. Efflux of potassium ions is nothing but exit of potassium ions. Exit of potassium ions means exit, there will be decrease in positive charge within the cell. So the decrease in positive charge within the cell. So there will be increase in negative charge. Okay. Efflux of exiting, for suppose here the cell. Here the potassium will get exit from efflux exit out from cell. Here the potassium is getting exit means what? There will be increase in negative charge. Okay, like I said, there will be increasing negative charge in repolarization. Okay, here in depolarization sodium and calcium plays a greater role, where in repolarization potassium plays a greater role, where in hyperpolarization chloride plays a greater role. Okay, this is ligand gated ion channels. Ligand means nothing but a drug molecule or it may be neurotransmitter. Gated. Here the drug or a neurotransmitter gating the ion channel means opening the ion channel. Okay. So ligand gated ion channels. Okay. Now I will tell some examples regarding ligand gated ion channels. Okay, for now you just remember these examples. Later on we will discuss about everything. Okay, now suppose examples of ligand gated ion channels are nicotinic ion channels. These are muscarinic cholinergic receptors. These are cholinergic acetylcholine receptor types. Okay, acetylcholine based nicotinic receptors. These are okay. Now 5-hydroxytryptamine 3. Okay, it is very important. In the case of 5-hydroxytryptamine, all subtypes are G protein coupled receptors, but only 5-HT3 is ligand gated ion channels. And again GABA A. Okay, GABA A is mainly responsible for the influx of chloride ions. So influx of chloride ions means it leads to the relaxation. Okay. In upcoming classes we are going to discuss about all these neurotransmitters in a detailed manner. Okay, and some other examples like NMDA receptors, glycine receptors, kinase receptors. In topic of neurotransmitters, in upcoming classes we will learn about all these neurotransmitters. Okay, for now just remember these. 5-HT3 is very important. Okay, now whenever comes to the structure of ligand gated ion channels, okay, it was pentameric. What is pentameric? Pentameric means it has 5 subunits. 5 subunits, so it was called as pentameric. What are those 5 subunits? 2 alpha and 1 beta, 1 gamma and 1 delta. Okay, for suppose it looks like this. Okay, it has 2 alpha subunits. Okay, 1 beta subunit, 1 delta subunit and 1 gamma subunit. So in case like for example we are talking about nicotinic receptor. Okay, nicotinic receptor, nicotinic ligand gated ion channel. Okay, in order to activate this ion channel there must be 2 acetylcholine molecules that must bind between this alpha and this gamma subtypes. Okay, there must be 2 ACH molecules must bind to activate this ion channel. Okay, ACH molecules generally they are bind between subunits like this alpha and gamma. Okay, this was that. It was structure of ligand gated ion channels.